Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today I'm in front of Salt River Fields, which is the brand new home of the Arizona Diamondbacks and the Colorado Rockies. Up until this year, the Diamondbacks and Rockies had their spring training home in Tucson. They were the only two teams down there. The problem with that is that when they weren't playing against each other, they had to drive all the way up to the valley here, which is a good 1.5 to 2 hours to play their games. Not optimal. Gorgeous field, cost over $100 million. You should come out and check it out whenever you're in town. Also across the highway there is the Talking Stick Resort, which was about a $440 million project, 500 rooms, 240,000 square feet of casino space, 2 great golf courses. So what they've done up here is tremendous. The topic for today is shoulder impingement syndrome. There's a bunch of names for this: shoulder impingement syndrome, shoulder bursitis, rotator cuff syndrome, dealer's choice on that. I use that term because of the casino, across the street. Anyway, so it's a very, very common problem. Shoulder issues affect millions and millions of Americans in this country every year. Thankfully, over 90% of shoulder impingement and bursitis is non-operative, and thankfully self-limiting. Oftentimes it just goes away. But there are some treatments that can be very effective in the interim to help it go away faster. One of those is anti-inflammatories. And they call it bursitis because it is an inflammation issue. What you have is the rotator cuff musculature, which allows your shoulder to do all of these beautiful movements. And then you have a bone in the shoulder called the acromion. So you have muscle here, I'll just make a fist, and then you have the acromion, and your shoulder's moving all around, and the area between the muscle and the bone can get impinged. On top of the muscle is a bursal sac called it's a bursa, and it can get inflamed, and you can get bursitis from that kind of a movement. It can be very painful. So there's a few things that can be done. One is anti-inflammatories by mouth. That can be effective. Another is an injection of steroid into the space between the muscle and the bone. That can be very effective. So you shouldn't have too many injections. One every few months is fine. And that can be effective in getting the pain level down and getting you back to functionality and recreational activities. Another thing that can be very effective is physical therapy. Physical therapy usually involves low-tech kind of resistance type of things with TheraBands. Those are those rubber band kind of exercises. You can also do some active and passive stretching and strengthening, but that can help the rotator cuff syndrome get better and the inflammation to come down. If those don't work, no, they do over 90% of the time, but a surgeon can do an arthroscopic procedure, which is minimally invasive and takes maybe an hour as an outpatient, and they can shave down that bone where the muscle is impinging up against. So that's only about an hour procedure. It can be very effective, and it can help alleviate the pain, hopefully once and for all, because now you have more clearance for the muscle to and the shoulder to move and the muscle to clear underneath that bone. So that's the skinny on impingement syndrome. Preferred Pain Center, we get patients in very quickly. We have a 24-hour guarantee. We have board-certified fellowship-trained pain doctors. We have a chiropractor. We have a physical rehab doctor. We have spinal decompression treatment, which can be very effective for neck pain. Sometimes impingement syndrome also has a portion of pain coming from the neck. A lot of patients don't realize that. They're like, well, I tried physical therapy before and it didn't work. Maybe it's because some of the pain was coming from your neck. So our doctors can work that up. Maybe you might need an MRI of the cervical spine, and they can help evaluate that and let you really know where your pain is coming from. Preferred Pain Center, your pain stops here.